All right, is everybody in, Jess?
I believe so, yes.
All right, well, welcome to South Dakota Project First Line Office Hours. This is the August 2023 edition. South Dakota Project First Line Office Hours provide an opportunity to listen to new educational topic each month. Office hour participants can join in a question and answer discussion on topics related to infection prevention. August focus is germs live in the respiratory system, and you can stop the spread of germs, and it can be as easy as hand hygiene. I am Rebecca Syme. I am an RN. I have a background in many things, many areas: surgical services, long-term care, dialysis, among some others. My coworker, Jess Dinko, also has an extensive background. She is a registered respiratory therapist, has a long-term care CIP certification. And additionally, now new to office hours, we include Sherry Fast. Sherry also has an extensive background and has a CIC certification, a long-term care CIP, and she works with the Healthcare Acquired Infection Program for us and brings a great amount of knowledge. South Dakota Project First Line is a CDC infection prevention and education initiative designed to give frontline healthcare workers knowledge to perform their daily duties with confidence. You can go to our resource pages on the website. There we have all of the different things that we cover in this. Germs live on devices, in the gut, on wet surfaces, and many others. We also have lots of additional resources that can be found on our website for you to learn and use.
Hey, Rebecca, I'm not seeing your slides. Are you showing slides?
Hold on, I think.
I don't know if anybody else is, maybe it's just me.
Okay, I'm sorry, I thought Jess was gonna share the slides.
Yep, let's try it again. Are you guys
There you
seeing
go.
them now?
Yep, thanks.
Perfect.
Thank you,
thanks,
Sherry.
I'm
Sorry,
gonna go back.
Jess and I communicated, but maybe I didn't communicate that oh so well.
Nope, I don't know. Had that before, so some technical problems this morning. So Rebecca was just talking about the resources, so I believe we're about right here.
Okay, perfect. The next slide shows a video that you can watch in your time. Because our time here isn't extensive today, you can go to the website and watch that video on recognizing infection risks in healthcare. Has some good stuff in it. Next slide. Today's topic again is germs live in the respiratory system. Where's the risk? How do germs spread? By talking, breathing, sneezing, and coughing via droplets. Poor ventilation of lots of people increase the likelihood for germs to spread. Germs in the nose and mouth spread to the skin and the hands when people are touching their faces. They can spread to other surfaces or even other people. Next slide. Okay, germs that live in the respiratory system. Pseudomonas in the respiratory system, it is often in the form of pneumonia. They develop resistance to several types of antibiotics, and these germs can be multi-drug resistant. Staphylococcus aureus, or MRSA, the leading cause of skin and soft tissue infections such as boils and cellulitis. Most infections are not serious, but can cause bloodstream infections, sepsis, pneumonia, or bone and joint infections. Viruses like influenza and COVID, and many more. Next slide. Items that regularly involve respiratory droplets. I'm sure you can think of many more that are related to the work you do, but think about oral cares, CPAP machines, intubation, via nebs also. Next slide. Infection control actions to reduce risk. Hand hygiene is our #1 way. Making sure that you're using the appropriate PPE for the setting. Masking is another way that we can control that. Knowing how to properly clean and disinfect are very important. Those high touch areas, reading product labels, knowing dwell times. Also the obvious and easy ones that we can all do, which is covering a cough or a sneeze. Use a tissue, use the inside of your elbow, immediately perform hand hygiene, and then being mindful of ventilation and your proximity to other people. That kind of covers my area. We at South Dakota Project First Line work with Sherry as stated. So at this time, I'm going to let Sherry kind of maybe give a better introduction of herself and take it from here. You're on.
Okay, had to unmute. So thank you guys for asking me to join the call. Anytime I can share any kind of information, I'm happy to do so. One thing that we do, we are contracted with the Department of Health to come into facilities and do proactive ICARs. So that can be for hospitals, nursing homes, clinics, outpatient centers, dialysis units. So we really just are a non-regulatory new set of eyes. So we look and we try to help you identify processes that you can maybe improve upon to reduce infections in your facility. So in relation to respiratory care, there's a few things in our tour across South Dakota and our ICARs. We wanted to share some common themes that we're seeing. And so we thought this was a good way to tie into those same topics that Project First Line has. So I'm going to show you a few photos of things that we have found in South Dakota facilities over the last few months, and these are consistent themes. So when we talk about respiratory, we know that it's important to reduce anything we can to prevent pneumonia and any kind of respiratory infection, but how do we store these items and what can we do? Those are all very important parts of preventing infections. So teeth and gums, we know they're reservoirs for germs. Germs can travel down the mouth. If we don't get that plaque and things off of our teeth, that can harbor a lot of germs. Biofilm builds up in the mouth. And so it's very important to do oral care with our residents and our patients and offer them the ability to do that if they can do it by themselves. But how do we store those items? So these are a couple of photos of things that we have found. And I hope that you're not doing this in your facility, but if you are, I challenge you to walk through your facility with new eyes and see where are these toothbrushes and toothpaste being stored. On this paper towel dispenser is not the ideal place, and not on the sink behind the faucet is not the ideal place. So I challenge you again to look at your processes and see how are you doing it. We don't want to just store them in a plastic bag. That's probably better than what's on here, but the toothbrush is actually moist and wet. And so to put a wet toothbrush in a plastic bag and close it up, that's just going to breed more infection and germs growing in that plastic bag. So probably the best choice would be to put your toothpaste and your toothbrush in an emesis basin and then cover that and put it in their drawer or somewhere safe so that germs can't get on there. The emesis basin needs to obviously be clean. So I would rinse it out and dry it out before putting those supplies back in there. And then always teach your CNAs or whoever is doing the mouth care that they need to wear gloves and hand hygiene before and after they do that. Very, very important to do that. Let's see, can you ladies think of anything else I'm missing with oral care? I think it's a huge area that's not given enough attention probably.
I would agree with Sherry. It is something that's really up and coming in a lot of discussions for infection control. The one thing too to note is to look at your policy and what does your oral care practices say in there and make sure they're consistent with what your staff is doing within your facility.
You know, ideally, I did some research last night on just how should you actually store toothbrushes. And, you know, the American Dental Association says store them upright, not with anything else. I know in our long-term care facilities and our hospitals, that's not probably an option. But at home, even look at your processes at home. Do you store your toothbrush with everybody else's? Probably not a good practice. So just think about that and be more mindful of our oral care and how we're doing that. So next slide. So oxygen treatment. So when we talk about respiratory care, we always want to think about the oxygen treatments that we're doing. It's not always about delivering the treatment, but then again, how do we store it? How do we clean that equipment? So APIC recommends only sterile water to clean our nebulizers. And the American Association of Respiratory Care says sterile water or distilled water, but not tap water. And I know a lot of facilities just rinse with tap water. And so please look at your policy, and that's probably going to need some changing in the real near future about those standards. So just think about that. Those nebulizers need to be completely taken apart, rinsed out and dried, and then stored in bags that have like little holes in them or a mesh bag so they can dry properly. Laying them out on a towel like this is probably not the ideal situation after they're dried. And Jess, you correct me, you're the respiratory therapist. A lot of this is what I've learned from you. Also, storing that first picture on the bed, probably not the ideal place to store that either after it's been used.
Yep, Sherry's correct in the recommendations that are coming out from APIC, and that has been consistent with AARC has recommended for the last couple of years. I do want to touch on that CPAP that's laying on that bed. In addition to cleaning the nebulizer, and there's processes for that, we need to make sure that those CPAP masks are getting cleaned daily. Make sure they're in a policy that says that you guys are cleaning them daily, and not just the mask that needs to be considered. The head strap and the pieces that attach to that mask also need to be on a cleaning schedule, and really make a note of that foam, or on this one, it's a plastic piece that causes the seal to the face. There's a lot of times that can get contaminated and it's overlooked in the cleaning process. So really ensuring that is cleaned properly and thoroughly becomes a huge part of preventing pneumonias and HAIs.
So the thing that I think of here, and maybe like Sherry, I'll direct it towards you, Jess, is, I think high touch areas, the dirtiest thing in the room probably is that side table, and the bed also that area. So what would you maybe recommend or think about or think for people to include in policies of where they could store that CPAP or those respiratory items to, again, do some good?
Absolutely, you're right. It's quick and easy to either hang it up behind a flow meter, store it on the bedside table, or whatever's close to the resident. A lot of times our rooms don't have a lot of plugins, so it's the one that's close to the resident where everything is being stored. So you think about that, and there are a lot of germs in that area. Best practice is to have some type of storage container, bag. If you're going to do a bag, if it's plastic, it needs to be one that has the little holes in it. Like Sherry mentioned, there's actually a company that makes those. They're called nebulizer bags. The nice thing about those is you should be routinely changing your nebulizers. So that also gives you the opportunity to write on there the date that they should be discarded, so you know that it's been done properly and it can be checked. But yes, finding some place to store them. And even if you are doing a bag or something, if there's room inside that bedside table, it's probably got less germs coming by it than sitting on top of that table. So just really starting to think about what are our processes in our facility, how can we make some changes with storage, and where these are. Sometimes the space is pretty limited, so we understand that can be challenging.
Okay, you can go to the next slide. Okay, so still staying in the respiratory area, we want to think about our concentrators and things like that. So just kind of talked about the CPAPs and the mask and how we can store them. You can see that first picture, probably not the ideal situation there, how that is being stored and kept. So just be mindful of that if you're long-term care, and even in the hospital. We have a lot of equipment in our hospitals and on our overbed stands, and people come in from home and they want to bring their own supplies. So just be mindful of that. But when we talk about the oxygen concentrators, we often forget that can also be a reservoir for germs, or a potential reservoir for germs. So we think about those filters behind the oxygen concentrators. Those should be changed out or at least looked at weekly. If they're dusty and dirty, they need to be rinsed out and dried. And then make sure that you're changing those filters every 6 to 12 months. It probably depends on the environment and how dusty they are, but make sure those are at least getting changed out. You want to clean the outside of the concentrator as well. Don't forget that. We often find very dirty concentrators, dusty. It doesn't take too long just to run a rag over those concentrators and make sure they're clean. Just kind of already talked about a storage bag, best for storing. And so we can go to the next slide. Other things we find when we are thinking respiratory and things that are inhaled in the air, let's look at fans. You can see in that first photo, we see many fans throughout all areas. Every facility we're in, we find fans and they're dirty. So who's responsible for cleaning those fans? When the residents or the patients turn those fans on, where is all that stuff going? It's blowing right into the air and they're inhaling it. So if you already have somebody that's compromised or has tough time breathing, we certainly don't want to put that back into the air. And I also think about, even for myself, I have very bad allergies sometimes, and I don't want to be breathing that stuff in. So I think about even the staff breathing those contaminants in. This middle picture is a humidifier that we found that's very dirty. Don't neglect those. That picture speaks for itself. I don't think I need to talk about that. And then also look at your environmental services, your cleaning carts. Do they have feather dusters on there? Feather dusters are really a thing of the past. They really trying to get all facilities to go to microfiber cloths because we're not dispensing any more dust in the air. The microfiber actually traps the dust into the cloth. And so that would be the better choice. So just when you're doing your rounds, look at that and try to make those changes. Okay, next slide. The next area, when we talk respiratory and we're relating back to infections, we talk about isolation and carts. So obviously we can see that this first picture is not the ideal situation that we want to have in a isolation cart. Now, in full disclosure, this was not in a patient room, but it was ready to go to be put into a patient room, and the staff jacket was hanging over the top. Now, that is not appropriate, so just be aware of that. I hope we don't find that anywhere, but we did find it. So just be aware of that. That second cart, yes, they have all their supplies there. They're trying to do a good job, and I give them props for that. But that hand sanitizer is so close to that bottom tray, I could hardly get my hand under there to do my hand hygiene. And then when I did try to do it, there was nothing in the hand sanitizer. So we have to make sure that somebody is watching our hand sanitizer dispensers. They're checking that they're not expired and that they're ready to go. This was right by a resident's room, so I don't know if it just got missed, but if there's no hand sanitizer, you're not going to use it. That's my point. And then you can see that last cart. This is an example of a cart we found in a facility. Great cart. If you have the ability to get carts like that, that's wonderful. When we're on our iCars, we look at your isolation carts. We do a lot of talking. We interview your staff. We ask them about, do they know what they can implement? Do they know what precautions they would put on a draining wound or someone that's coughing a lot of phlegm up? So we do talk to them and about that. So, and we ask them about where their signs are. Do they know where their signs are? And so just be mindful of your isolation carts and think through things like that. So next slide.
Yeah, I'm just going to jump in and add, make sure those isolation carts are on a cleaning schedule as well, especially those like the bag one. There's a lot of traffic by those. We found many of them that were dirty with something maybe splattered on them, that type of thing. So are they going to the laundry? Who's cleaning them? Those type of things. That's somewhere that we're seeing is getting missed and neglected.
Okay, you can go to the next slide. So we find a lot of good things when we're out in facilities too. We tend to focus on the negative like everybody, but we do find a lot of good things. And we loved this little picture we found recently of the little trash. We love trash. So when we think respiratory etiquette, we think about making sure that our residents and our patients are putting their used tissues in the trash right away. We think about gloves. We don't need to have excess things sitting around. So if we can promote things like that, that's always a good thing. We are seeing some UV lights for disinfection, and I think this is wonderful. The thing I want to mention with this is this does not replace cleaning and disinfection. So you have to do that part first. This is just an adjunct, an extra step to give you that extra sense that you've cleaned really well, but you still have to clean and disinfect first. So it's a great process, but it doesn't replace the cleaning and disinfection. And then this last storage, what a great looking oxygen storage unit. They don't all look like this. So I'm going to give kudos to them. You guys have anything on that?
Just with the oxygen storage, if your facility is not already doing so, the fulls and empties have to be stored separately. They cannot go in the same rack. So make sure that they are separated, and they need to be labeled that this rack is full and the other rack is your empties. That's a standard that's from OSHA. So if you're not doing that currently, make sure that process is happening.
Okay, next slide. And then lastly, I guess I just want to end with the importance of hand hygiene. We can't do it enough. We can't stress it enough. We find signs throughout facilities. I loved this one. You know, the 10 most common ways of spreading disease are 10 little fingers. And it's so important that we remember that. You can see this worker coming out of a room doing hand hygiene. That is not always the case. When we do our ICARs, we kind of hang out in the hall and we do we count missed hand hygiene opportunities, and we see them a lot. We usually quit counting about 20 in an hour. And so it is pretty overwhelming for facilities when they think they're doing a great job, and then we tell them all the times that we see staff missing that. So just be mindful of that. You can teach and teach and teach. It doesn't mean they learn. It doesn't mean they do it consistently. So I would recommend you do frequent audits. You have secret shoppers. Hand hygiene is critical. I hope you don't get an infection control tag, but you know, I talk about that, but it's more about patient safety and than a tag, because healthcare acquired infections are very costly. And if it extends a patient's stay, or it can just be very costly for your facility, and we don't want that. So hand hygiene critical to all of this. So I'll just end with that, and I'm happy to take any questions that you might have.
Feel free to come off of mute, or you can place any questions in the chat box. Same with the South Dakota Project First Line. If there's any questions for that, if you're looking for resources or anything, we are happy to assist with those as well.
We'd really like to know if you guys find this helpful. We're just trying to engage people a little bit and spread some knowledge so you can be proactive in your infection control in your facilities as well. So.
All right, if there's no questions, please, if you think of something once we wrap up today, reach out to us. You can contact the Project First Line team through our website, and Sherry handles all of the proactive ICAR scheduling, so you can reach out to her on that. Otherwise, we will wrap up for today, and we just want to thank you for joining us and being here to listen and find some common themes that we're seeing that you can take back to your facility and look for. So thanks for joining today.
Yes, thank you. Thanks, Sherry.
Yep, thanks for having me.